Our 5-year program is for students who are sitting international examinations like the International Baccalaureate or A-level exams, or students who have completed their high school training and have completed an international foundation year. So that would be the entry route for a 5-year program. And our 6-year program is for students who might not have the required science subjects in their foundation year or high school training. And we offer a 1-year foundation program with students then progressing into a 5-year program. So these are all subject to performance, competency in the English language, and also a successful admissions interview. Our 8-year program is quite unique in that not many of the Irish universities or European universities will offer this opportunity. We have two different options for an 8-year program. One is a PhD program, which is an 8-year program. You join the medical degree as normal into the 5 or 6-year program, and at year 3, you apply to do your PhD program. So this would be relevant if you wanted to pursue a career in academia or career in research. And it's a very popular program, but it only has a small number of places, making it very, very competitive. Our second 8-year program is one of the first and only of its kind in Europe. It's a combined medical and engineering degree. And again, you have to be a student on the medical degree to transfer into this program, and the same rules would apply. You apply in year 3, and if successful, you complete your engineering degree and then come back and complete your medical degree. So lots of opportunity for further development, depending on your areas of interest or your career plans, if it's industry, research, or if you want to just be a doctor, that's also okay. And most of our students will opt to do just the 5-year program and continue with their postgraduate medical training. So just to give you some ideas, there are other options if students are interested in research or academia, available to you here in Galway. So a quick run through our curriculum, just to give you an idea of what you can expect. So I mentioned our foundation year. So this is what we call year 0. So this is where you study the subjects of biology, physics, chemistry, and we also have an introduction to medicine. So this prepares you to transfer into year 1 of the program. We have year 1, year 2, and year 3, and they're all very much classroom based, but we'll have laboratory training, clinical skills training as part of anatomy, pharmacology, and physiology. The building on the left-hand side, which I've mentioned already, is the human biology building. And this is where our students spend the first years of their training, what we call the preclinical years. And this is where we have our laboratories for anatomy, pharmacology, and physiology, and our gross anatomy dissection room. So we are one of the only universities that still use cadaveric dissection in our anatomy training, and it's one of our unique selling points here in Galway. So our students get to experience anatomy in a very, very true to life scenario. Moving into the clinical phase of the program, we have a huge celebration at the halfway through year 3, and you'll see a lot of students very happy in their scrubs. We have what we call as a transitioning ceremony. So this is where students move from the preclinical training into the clinical training and clinical part of the program, and it's where they get their first set of scrubs. So it's a big moment. It marks a very important juncture in medical education, and you can see the students are very, very happy, but also very excited to move into the clinical phase of their training. The clinical phase is, as you can imagine, a very, very intensive, demanding program, and it's the second 2.5 years of the medical degree in Galway. So in year 3, semester 2, this is your first introduction to the clinical side of training, and this is where you complete 15 weeks, so a full academic semester in the hospital environment, and you will do clinical rotations in general medicine, general surgery, and acute care. In year 4, it's your first full clinical year, and it's a really, really big year and an exciting year for a lot of students. It's where we introduce you to the specialties of psychiatry, general practice, pediatric medicine, and obstetrics and gynecology, before we prepare you for life as a junior doctor in year 5. And this is where you will do rotations in general medicine and general surgery at a more advanced level than year 3. And we also offer junior internships, which is about preparing you for life as a junior doctor when you leave us here in Galway. So a very quick introduction, but feel free to ask any questions in the chat box about the content. We get asked a lot about opportunities to do research. And our main university, our parent university, is a research-intensive institution. So we're very research-led, research-driven, and that is no different in the School of Medicine. And we actively encourage our students to get involved in research as early as possible in the programme. And we do this through our 8-week summer research programme, which is open to all students. The really nice thing about this programme is it's fully funded. So you get to spend one of your summers in Galway from year 2 onwards on a fully funded, fully supervised research programme, which often leads to publications with your supervisor. It can lead to attendance at international or national conferences, and it's really, really good for your CV. And it's a great opportunity to get involved in research, develop your research skills, but in a supervised, structured way. So that's something that we encourage all students to get involved with. If you've been doing research on medical education in Ireland or across the world, you'll see simulation popping up a lot. And our university and our medical school has the most state-of-the-art simulation centre based in our Clinical Science Institute. So it's the newest of its kind. It's the largest and most modern facility in Ireland. And it's a really, really great opportunity for us to teach our students, but also for students to get their clinical skills as perfected as much as they can in a really safe environment before they go to the clinical hospital environment. It's a really, really impressive facility. So if you do get to come to Ireland before applying to our programme or before registering, this is something that we would show you around and introduce you to all of the technology and the simulation suite, all our high fidelity mannequins, and we may even get some of our students or our tutors to share some of their knowledge and experience in this area. So it's a very exciting time for simulation. It does not replace the clinical training on our programme, it complements it. And the main aspect of a simulation centre in medical education is to provide students with a safe environment to practice their clinical skills. So it's a really important part of training, but it does not replace the face-to-face patient interaction.